Hi, I'm going to be giving my informative speech on how to perform CPR. I think it's such an important thing to know. You never know when you can use it to save somebody's life. So when I was researching this topic, I found a statistic that said every year about 335,000 people, or around 918 a day, die from coronary heart disease. So I'm going to start by when to and who can perform CPR. Regarding that statistic I just told you, 88% of those that die from cardiac arrest happen at home. So that statistic should give you some motivation to learn CPR because you never know when you can use it on a loved one, and even somebody in your own home. So the technique I'm going to show you today is identical between adults and children, and there's one little difference between infants that I'll tell you towards the end. And if you're afraid that maybe you won't be able to use CPR or you're able to learn CPR, a study found in the Resuscitation Journal states that age has no effect on the perceived level of exertion used while performing CPR. So please don't use age as an excuse not to learn CPR. I'm going to start now by giving you an acronym that I really want you to remember, and it's CAB, C-A-B. I've also heard it used as ABC, and either way is fine to remember. As long as you know that CAB, those letters are arranged in the actual order of steps you use in CPR. So CAB stands for C, circulation, A, airway, and B, breathing. I'm going to go over each step, what they consist of, and how to do them. So we'll start with C, circulation, and basically this is sending blood to the brain if somebody is unconscious and not breathing. And to do this, you're going to use compressions. So to do a compression, you're going to place one hand on the person's lower breastbone. And obviously, if someone's unconscious, they will probably be on the floor, and you're going to want to make sure that you roll them onto their back so you can do this. So once you have one hand on the lower half of their breastbone, you're going to want to put the other hand on top. And you can either interlock your fingers or not, it doesn't matter. To give a compression, you need to push down 2 inches. And what my instructor told me when I took this class was if you aren't pushing down hard enough or far enough to break ribs, then you aren't doing it right. And I know that sounds harsh and really horrible, but it's better to do it right and potentially save somebody's life. So once you push down and you're coming back up, you need to make sure that the person's chest can come back up to their regular position. And while doing these compressions, it needs to be a rate of 100 compressions per minute. And I know that's really hard to keep track of, so what I was taught was to go along with the song Staying Alive. So, staying alive, staying alive. I find that's a much easier way to keep track of your rate of compressions. So the next step is A, airway, and you're going to do this in order to get ready for the breathing portion, which we'll go over next. So you need to open the person's airway, and to do this, you can put one hand on their chin, one hand on their forehead, and push their head back. And okay, we'll go to the next step, breathing. You need to keep their airway open for this. To do your breaths, you pinch the person's nose, put your mouth to their mouth, and give 2 breaths. Each breath needs to be about 1 second long. It's important to know that you can't interrupt compressions for more than 10 seconds. So as long as you give your 2 breaths in this 10 seconds, you'll be fine. Kind of a little side note, there's been some research that the breathing portion of CPR isn't actually necessary and can be potentially harmful, but it's still taught with the breathing, so that's why I'm including it in my speech. Another part of CPR that can potentially be even more life-saving is called an AED. And what this will do, you'll hook it up to the person's chest, and it'll read the chemical signals of a person's heart. And it can give shocks if a shock's needed. It'll tell you if CPR is still needed, but you never know if you're going to have one around, so I won't go into any more detail, but studies show that if you begin CPR early and use an AED early, that's the best chance of saving somebody's life. So now that we've gone over all the individual steps of CPR, I'm going to tell you the full cycle of CPR. So if you come upon a person that is unconscious and not breathing, or even gasping, because gasping is a sign of cardiac arrest, you need to call 911 immediately before you begin any kind of treatment. And if you need to perform CPR, you're going to start with compressions. You're going to give a set of 30 compressions and 2 breaths. And you need to continue the cycle of compressions and breaths until one of 3 things happen. Either the AED arrives and it'll tell you what steps to take, or the person becomes responsive, or trained help arrives, and at that point you're going to want to let them take over. So that's the full CPR cycle. Like I said earlier, there is one difference for infant CPR, and that difference is when you're doing compressions, you're going to want to use 2 fingers to do your compressions instead of both hands. That's it. I hope you guys maybe learned something and you can take some information away from this, and if you ever find yourself in a situation where you need CPR, this information can maybe help save somebody's life. So thanks for listening.